Most people dedicate years to monitoring what they eat, taking prescribed medications, and regularly checking their blood pressure. These habits are undeniably important and often emphasized in every medical conversation. However, there is one daily behavior that rarely gets discussed, even though it occupies nearly a third of your life. It is something you do every single night for 7 to 8 hours without fail. That behavior is your sleeping position for individuals over the age of 60. This seemingly simple habit may have a far greater impact on heart health than most realize. For decades, the medical community largely considered sleep position to be a matter of comfort rather than a factor influencing cardiovascular health. Physicians focused heavily on diet, exercise, smoking, and genetic predisposition. Sleep was treated as a passive state, a time when the body simply shut down to recharge. But modern research has significantly changed that understanding. Sleep is not a passive process at all. It is an active, dynamic period during which your cardiovascular system undergoes constant adjustments. Your heart rate shifts, your blood pressure fluctuates, and your circulation adapts depending on how your body is positioned. These changes become increasingly important as you age, especially after 60, when the body's resilience naturally declines and small inefficiencies begin to matter more over time. For many years, the primary focus in cardiac care has been on treating conditions once they become serious enough to require intervention. Surgeons, specialists, and physicians often concentrate on what happens during procedures or acute events. Yet there is a growing recognition that prevention plays an equally critical role in long-term health. When you step back and examine the patterns that lead to heart disease, it becomes clear that they are rarely the result of a single event. Instead, they develop gradually through the accumulation of small, repeated habits. Among these habits, sleep stands out because of its consistency. You repeat it every night, without exception. Over decades, this repetition becomes one of the most significant influences on your body. The way you position yourself during sleep is not random in its effects. It interacts directly with your anatomy, your circulation, and your internal systems. While medications and lifestyle changes can help manage risk factors, something as simple as adjusting your sleeping position offers a unique advantage. It requires no cost, no prescription, and no equipment. It is a subtle but powerful way to support your heart during the hours when your body is naturally trying to recover and repair itself. One of the most important factors to understand is the actual position of your heart within your chest. Many people assume it sits directly in the center, but that is not the case. The heart is slightly offset toward the left side of your body, with a larger portion of its mass positioned there. This anatomical detail has meaningful implications when it comes to how gravity affects blood flow during sleep. When you lie on your left side, gravity works in harmony with your heart's natural orientation. Blood can move more efficiently, and the heart does not have to exert as much effort to circulate it. In contrast, when you lie on your right side or on your back, the alignment is less favorable. The heart may need to work slightly harder to maintain the same level of circulation. While the difference may seem minor on any given night, it becomes significant when repeated over thousands of nights. After the age of 60, when the heart muscle may already experience reduced flexibility or efficiency. Even small improvements in workload can make a meaningful difference over time. Supporting the heart in this way allows it to function more effectively during sleep, which is when recovery processes are most active. Another critical aspect of circulation involves a major blood vessel known as the inferior vena cava. This large vein plays a vital role in returning blood from the lower half of your body back to your heart. It runs along the right side of your spine, carrying blood from your legs, abdomen, and pelvis. Its position makes it particularly sensitive to pressure depending on how you lie down. When you sleep on your right side, the weight of your internal organs can press against this vein, partially compressing it. This compression does not completely block blood flow, but it can slow it down. Slower blood return means the heart has to compensate by working harder to maintain proper circulation. Over time, this additional effort adds to the overall workload of the heart. In contrast, when you sleep on your left side, the pressure on the inferior vena cava is relieved. Blood can flow more freely back to the heart, improving circulation and reducing strain. For older adults, this is especially important because the efficiency of veins naturally declines with age. Supporting unobstructed blood flow becomes a simple yet effective way to maintain cardiovascular health. Circulation during sleep is also closely linked to the risk of blood clot formation. Blood clots often develop when blood flow becomes sluggish or stagnant in certain areas of the body, particularly in the deep veins of the legs and pelvis. This condition, known as stasis, is one of the primary factors contributing to clot formation. While many people associate this risk with long flights or extended periods of immobility, it is important to recognize that sleep involves several hours of relative stillness every night. If circulation is not properly supported during this time, blood can pool in certain areas, increasing the risk of clot formation. This risk becomes more pronounced after the age of 60, as blood vessels lose elasticity and circulation naturally slows. Sleeping on your left side helps promote more consistent blood flow, reducing the likelihood of stagnation. While no single habit can completely eliminate the risk of blood clots, improving circulation during sleep is a valuable step in reducing that risk over time. Beyond circulation, there is another system in your body that becomes highly active during sleep, and that is the brain's waste removal system. This system works overnight to clear out metabolic byproducts that accumulate throughout the day. These substances include proteins and toxins that, if not removed efficiently, can contribute to long-term neurological issues. Research has shown that this cleansing process functions most effectively when you sleep on your side. Among side positions, the left side appears to offer additional advantages due to the way fluid pathways are structured within the brain. Efficient removal of these waste products is important not only for cognitive health but also for cardiovascular health. The brain and the heart are deeply interconnected, sharing the same vascular system. When the brain's environment becomes inflamed or compromised, it can increase the risk of stroke and other cardiovascular events. Supporting this nightly cleansing process through proper sleep positioning is another way to promote overall health as you age. Another often overlooked factor is acid reflux, a condition that becomes more common with age. Many people experience nighttime heartburn or discomfort without realizing its broader implications. Chronic acid reflux can lead to inflammation in the esophagus, which may affect nearby nerves involved in regulating heart rhythm. This connection highlights the importance of managing reflux not just for comfort but for overall cardiovascular stability. Sleeping on your left side helps reduce acid reflux by keeping the stomach positioned below the esophagus. Gravity prevents stomach acid from traveling upward, reducing irritation and inflammation. This simple adjustment can improve sleep quality while also supporting heart rhythm regulation. Blood pressure regulation during sleep is another critical aspect of heart health. In healthy individuals, blood pressure naturally decreases during the night, providing a period of rest for the cardiovascular system. This process is known as nocturnal dipping. However, not everyone experiences this drop in blood pressure. When blood pressure remains elevated throughout the night, the risk of heart disease and stroke increases significantly. Sleep position can influence this process by affecting circulation and breathing patterns. Left side sleeping supports more stable circulation and may reduce disturbances that interfere with normal blood pressure rhythms. Over time, maintaining healthy nocturnal patterns contributes to better cardiovascular outcomes. For individuals trying to adopt this habit, the transition may require some adjustment. Many people naturally favor certain sleeping positions based on comfort or habit. Shifting to the left side can be made easier by using supportive pillows. Placing a pillow behind your back can prevent rolling over during the night, while a pillow between the knees helps maintain proper spinal alignment. These small adjustments can make side sleeping more comfortable and sustainable over time. The body is adaptable, and with consistent practice, a new sleep position can become second nature. It is important to recognize that no single habit guarantees perfect health. However, the value of small, consistent improvements cannot be overstated. Sleep position is one of the few factors that can be adjusted easily without cost or risk. It represents an opportunity to support your body during a time when it is already focused on recovery. By making this simple change, you align your body in a way that promotes better circulation, reduces strain on the heart, and supports overall health. As you reflect on your daily habits, consider how often you think about your sleeping position. For most people, it is something that has never been questioned. Yet it is a behavior repeated every night for decades. When viewed in this context, even a small improvement becomes meaningful. Supporting your heart does not always require complex interventions. Sometimes it begins with a simple decision made before you fall asleep. Your heart has been working continuously throughout your life, adapting to every challenge and demand placed upon it. It does not stop, even for a moment. Giving it a more favorable environment during sleep is a small gesture that can have lasting benefits. By choosing to sleep on your left side, you provide your heart with a slight but meaningful advantage. Over time, those advantages accumulate, contributing to better health and resilience. Ultimately, the goal is not perfection but progress. Small changes, when applied consistently, can lead to significant improvements in well-being. Sleep is a fundamental part of life, and optimizing it is one of the most accessible ways to support your health. By becoming more aware of your sleeping position and making a conscious adjustment, you take a simple yet effective step toward protecting your heart for the years ahead.